doing?
Good evening. All right, my name is Kadiatu Fofanah, students from FSCJ. I'm in the BSM program doing a presentation for my topic COPD. Anyone here have a family member that smokes? Okay. Anybody here smoke?
No, we don't smoke. We're very clean.
I don't believe you, but whatever. Anyways, my topic today is about COPD. The reason why this is very dear to my heart because I'm a nurse. I take care of people, and I see the trouble they go through, every day trying to breathe.
True.
So that's why I'm presenting this topic, trying to help somebody, to stop smoking so you don't kill yourself in the future. All right. So this is just my handout. I'm going to give everybody one so you can look over. All right. And feel free to ask questions. And I will demonstrate, certain things from over there. All right, there you go. And I also have a roster here for everybody to sign in. But first of all, anybody know what COPD stands for? COPD stands for chronic obstructive pulmonary disease. It's an umbrella of emphysema and chronic bronchitis. With COPD, it makes it very difficult for people to breathe because they have all this inflammation in their lungs. They're not able to breathe like normal people will breathe. It's an umbrella term, but it's mostly emphysema and COPD both combined together, or sometimes it could be just one. It's airway limitation. You're not able to breathe when you want to easily. And most of the time, it's caused by smoking. That's mostly the risk. A lot of people, risk factors. People smoke, and that smoking causes damage to their lungs that causes them not to be able to breathe in the long run. The more you smoke, the worse it gets. So, and sometimes dust, the chemicals in the air, pollution, that kind of thing causes all the problems with COPD. But for the most part, people that smoke have COPD. And the symptoms of COPD are shortness of breath, wheezing, chest tightness, you're not able to breathe, and you have this chronic nagging cough that doesn't go away no matter what you do. You just keep having all the coughing. And a lot of the time, because of the inflammation that have developed in your lungs, you have like thick mucus that, whenever you cough, that's all comes out. So it makes it difficult for you to breathe. Some people do take medication for it. But the one single thing that would prevent you from having all this trouble is not smoking at all. And even if you smoke, for a long time, when you stop, it makes a difference. So stop smoking is the one single thing that helps you with COPD. And a lot of people with COPD also have their lips can be blue, their fingernail bed can be blue just because of lack of oxygen in their blood. So that's part of the disease. And some people have difficulty even with daily activities, like trying to get out of bed. What?
Why do people's nails become blue?
Just because they lack of oxygen, they don't have enough oxygen in their bloodstream or their system.
Oh.
Anyways, COPD is a terrible disease, so I will advise anybody that's here or have a family member that smoke, to talk to them so they can stop smoking, because it's a disease that debilitates everybody that smokes. So that's the main reason why I'm talking about it. But there are also treatments that people can take. They have medications that can help with COPD. And also people, you can go to like a pulmonary rehabilitation where they teach you how to breathe better or with your activity, so you're able to do your daily activity without being short of breath so much. And also a lot of people that have COPD, their doctors would advise them to take the flu vaccine, just because if you get in contact with the flu, that makes it worse for you. And also people with COPD are prone to having pneumonia infection. So you want to make sure you go to your doctor, regular checkups, eat healthy, try to do your daily activities, you know, that kind of thing. That would help you. And I have a couple of things here that I need to show you guys, mostly about the medication. This is called Advair. It's one of the long-acting medications that people use with COPD. It's powder form, it's meter dose, which mostly it's prescribed like twice a day. This just helps decrease the inflammation in your lungs. People, it's easy to use. All you do is you open it this way and you push this down, which gives you your medication, and you inhale. After that, you can exhale when you're ready. And just make sure always you clean the top of it, and then push it back so you know your medication. And it's got a little dose number over here. This tells you how much you have left on your medication. So this is one of them. It's one of the long-acting medication. And this is also called Spiriva. Spiriva also is a long-acting medication. These medications, they both help like within 12 to 24 hours to keep the symptoms down, like wheezing or shortness of breath. And also this comes in a capsule form. So you open the capsule and you open your canister here, and then you pull it down, you put the capsule, you put it back in, and then you squeeze it from here. And it's got like a little pin inside that crushes the medication. So when you inhale like this, it helps you get your medication, and you can actually hear the capsule inside. That tells you, okay, I'm getting my medication. So this is another long-acting medication. And also, this is just a nebulizer machine. And most of the time, this is really fast-acting, like one of the short-acting medication that you could use. If you're having shortness of breath, this could help you like right away. And it's come in a little container like this. All you do is you twist this, open it, and you pour your medication in here. And then you lock it. And then you start your treatment. And it's actually vapor. As you can see the vapor, all you do is you put it in your mouth and you keep it there until you see no more vapor. So this is one of the other fast-acting medication. And all this medication, all they do is they decrease the swelling in your lungs. And because of the inflammation there, your muscles are tight. So doing this, it relaxes your muscle, helps you breathe better, so you can do what you need to do. So one more thing that I need to tell you guys about COPD. The impact that COPD have on our economy and our healthcare system is that about 13.6 million people are diagnosed with COPD every year. And also, just about the same number are people that are not diagnosed. You know, people have COPD and don't even know they have it. So if you have the symptoms of the nagging cough, which is chronic, and you wheezing, you short of breath, make sure you talk to your healthcare provider. See if there anything they can do for you, or maybe diagnose you with COPD, because the sooner you get diagnosed, the sooner you're gonna be able to start taking treatment or quit smoking entirely. So that's one of the biggest things. And also, because of the amount of money that's been spent on COPD treatment, it's about $36 billion dollars is being spent yearly just for the treatment of COPD. So because of that, health insurance increases because people have to pay for these things. So that's one of the driving force why we pay high insurance in this country. And this just doesn't affect the person that smokes or have the COPD. It also affects your family, because when you're not able to take care of yourself, they have to take care of you. So that's the main reason why, I am asking you guys, if you have a family member that smoke, or if you are smoking yourself, this is the time for you to quit smoking, really, because you have to put yourself first, or your family members, and just know that whatever I'm doing, it's gonna affect me. And even when you smoke, if you smoke around your family members, it's called, even they don't smoke, but it's called secondhand smoking. They could be indirectly affected too, because you are smoking around those people. So now I can say, if anybody have any questions, if anything that I need to answer for you guys, okay.
I was at the causes more smoking. Is there any chance of anybody getting COPD without being smoking?
Yes, there is a chance. It's very rare though. You have, some people have COPD, and it's what they call hereditary, which is, it's something that you are born with, but it's very, very rare. So it's not very common. So that's why I am putting emphasis on the thing that study have shown, that people get COPD from smoking. So that's why I'm putting emphasis on that. And also the air that we breathe, that's why the climate change and all that stuff, that's why people talk about that, that we need to control what we do, because chemicals too can be a contributing factor to people getting COPD. Any other questions?
Can we go to lunch?
When we are done, you can go to lunch, my dear. All right, now I have a little survey here that I want to give each and every one of you. Before I forget, I just want to pass this through. This is just, if you all can see over here, this is the inhalers. This is just like what some people carry. If you need it, like you going somewhere and you have, trouble breathing, you could use one of these inhalers if your doctor prescribed that for you. So that's one of them, and this is just the one that I was showing you guys. And these are the pills that goes in the Spiriva right here. So I'm just passing this on so everybody can just take a look.
Is it necessary to or either me?
I'm like, you're suspended.
Can you all just, alright. And this is my survey. Just read it. It's just mostly yes or no questions to see if this presentation's been helpful to any one of you. If you have any questions, just let me know. You have a question?
Yes, ma'am. So does insurance cover for these medications?
Yes, for the most part, insurance cover those medications. Depending on your insurance, you might pay less or you might pay more, but they are mostly covered by your insurance.
So if, say, I don't have insurance and I have COPD, what do I do?
Well, that we have resources, we have resources that I can give you, websites, and you can go there to apply for assistance, Medicaid or Medicare if you're old and cranky?
Ben.
Alright.
We need a pencil. We gotta erase if we got it wrong. So.
If you do
It's yes or no questions.
Still.
Alright. I guess that concludes my presentation.
Yay!